for all your healthcare needs, simple or serious. Starting with Emory can make a difference. Dr. Zreloff, why is it important for a healthy person to have a primary care physician?
Well, one would think that if you're healthy, you don't really need anything. However, you still need prevention. So we screen for high blood pressure and high cholesterol. We screen for cancers like cervical cancer and breast cancer and colon cancer. And then we also screen for healthy habits. Are you depressed? Are you exercising? Are you drinking too much? In my experience, everybody's got something, so hopefully you are healthy, but I believe everyone still needs a doctor.
So how does the primary care physician connect with specialists?
Well, overall, primary care doctors believe that we are whole person care doctors. So if a person does need a cardiologist, if they do need a gynecologist, we help them get into the right cardiologist for their problem. We help communicate, and we make sure that it's the right visit for them. You can also think about a person who might have chest pain. Well, our fear is that it's a heart problem, right? But other things can cause chest pain. You can have reflux, you could have a blood clot to your lungs. And so part of what we do is actually diagnose the problem to get you to the right specialist.
So when we talk about specialists, we're talking about really you being the captain of the ship, and then you have everybody else rowing. Why is it important to have a team working together?
Because everybody has their knowledge base, right? So if you think about it, I could never treat liver cancer, but I can help facilitate any complications that you might have, any other doctors that need to provide their expertise. You do need someone who is talking to all the specialists to put it all together in one good salad, so to speak.
I like that. I never thought of it that way. What are the other benefits of having a team of physicians working together?
Well, I think when you have a team, you have everyone that knows the best about their field, and they bring that together to create the best treatment plan for you. I think when you have a team of doctors, it's really important that they're in the same system because that way we share medical records. We even share ways of communicating. Our emails are synced, our pagers are synced. It just makes it much easier to talk together and create the best treatment plan for a person.
So how does it affect the cost of health care by having a team?
I think that's a very good question. When you have a primary care doctor, lots of studies have shown that you reduce your overall cost of care. In my opinion, you should all have a primary care doctor so that your team is the right size for you.
So how does someone get started with Emory?
You simply just pick up the phone and call. The phone number is 404-778-7777. That's our Emory Health Connection line, where you'll be talking with nurses to get you channeled to the right provider for you.
But you also said that it is better to call when you're feeling well rather than sick.
Yes, I would agree, just because it makes a lot more sense to be able to tell your whole story when you're feeling well. You have more time, there's nothing urgent or pressing, and it makes it just a better office visit to start your relationship with a long-term provider.
So can someone get started with Emory, say with urgent care?
Emory has 3 relationships with urgent care settings. Emory provides the medical directors for the minute clinics that you see in CVS. We also have relationships where we share medical records with Peachtree Immediate Care and Smart Care Urgent Care.
What is the Emory difference with primary care?
The difference is we provide coordinated care. We are the first step to providing health for you. So we will screen you, we will diagnose you, we will refer you. Whatever you need, we can do it all at Emory.
It can be hard to get to the doctor. How does Emory make it easier?
We have several locations. In fact, there are 120 primary care locations that are affiliated with Emory with over 250 primary care doctors.
So no excuses.
No excuses whatsoever. Everybody should get in.
Now, what does it mean to be an academic primary care physician?
Well, with Emory, we have a tripartite mission. That means 3 missions. We have to have a fancy word for it, which means we have service, which is taking care of patients, teaching, which is teaching medical students, nursing students, PA students, so forth, and then research. So providers in general do at least 2 of the 3 missions, which makes it so that we're more on the cutting edge. We're looking towards the future to see how we can improve medicine. And when we're doing that, we tend to provide better care.
Now it's your turn to ask me questions.
All right then. So I told you what I thought the Emory difference was, but what was your experience like at Emory?
The difference for me is that at Emory, my primary care physician, who is you, is so important because you do connect me when you find something wrong with me to other physicians within the system. But what's most important is that you work together as a team. So everybody has the same information at the same time. And there's something about having a group of people caring for you that makes it work. I was diagnosed first with breast cancer through my primary care physician, and then all the treatment with the oncologist was at Emory. Then when I was diagnosed with liver cancer, again through my primary care physician, everything came into place, even to the point of where when I developed a hernia, there was a doctor there to provide the surgery that I needed and the follow-up care. And I love the fact that when I go in to see a new Emory specialist, they have all my information there, right at their fingertips. So we don't have to start with, how many times did you have this? They know me already. And that's the reason I love Emory Healthcare, because they know me inside and out. And they work together as a team to keep me healthy.
What do you see as the benefit of having all of your physicians and treatments at Emory?
I think in this day and time when people are in a hurry, it's important that you have this tightly knit group who know you and know your body. But more importantly, each one of them communicates. So if you find something wrong, then Dr. Kuby is connected if it's something to do with my liver. If it's with my breast, Dr. Carlson's involved. Dr. Christie, if it's gastroenterology. I love the way it's interconnected. And what I also liked about Emory, when I was diagnosed with my cancers, I knew that if there was an experimental research program out there, there was a possibility I would be able to apply for it or be a part of it. And I think that's important because it's not just a healing hospital, it's also a teaching hospital.